The Target 12 investigators continue to track the state's coronavirus vaccine rollout, and today we're hearing more about when additional age groups should expect to get their shot. Target 12 investigator Eli Sherman has been covering this issue very closely and joins us now live via Zoom. Hi, Eli.
Hey, how's it going?
Great to have you with us. Eli, we do want to get into some of those specifics. First, though, you are our expert, quite frankly, on all the latest data. You track it every day. So can you give us at least an overview where Rhode Island stands right now in terms of vaccinations?
Sure. So about 11% of the state's population has been fully vaccinated at this point, which is one of the most important metrics that health experts are tracking. As you can see from this graphic, the pace of daily vaccinations really opened up its mass vaccination sites. But over the past 2 weeks, the pace has slowed and even decreased a bit. I covered the vaccine subcommittee meeting this morning, and health officials said one of the reasons this is happening is because the state has returned to allocating more of its vaccines to the municipal and specialty clinics, like the ones going on right now for teachers and other school staff. And that's a slower process than just funneling the doses through the mass vaccination sites.
So, Eli, the state's vaccination advisory panel made some news this morning with an update on Rhode Island's timeline for eligibility, and it looks different than what we've been hearing from the federal government.
That's right. Health officials said that the state's current projections for vaccine supply don't support President Joe Biden's push to make every adult eligible for a shot by May 1st. Here's an updated timeline for the Rhode Island Department of Health, which shows when different age groups can expect to become eligible. The dotted red line is where the state currently stands, and based on projections, people under the age of 50 are not expected to become eligible until the middle of May. This appears to contradict something Governor Dan McKee told UKIM yesterday when he suggested vaccine supply would likely exceed demand by that time. But one of the big caveats here is that health officials can't really see clearly what actual supply looks like beyond 3 weeks from now. So people, including the governor, are hoping that the feds really ramp up supply soon, and that could speed up this timeline.
So, Eli, we know obviously that's the future. As we look at right now, there's certainly a difference between being eligible and being able to get the shot. And that's one of the frustrations we're hearing from people. They just are struggling to sign up right now.
Yeah, our newsroom has been inundated with complaints since Friday, and viewers probably know by now, but on Friday, the state made 160,000 new people eligible, but they only offered up less than 2,000 appointments. So, demand really exceeded supply there. Another 1,600 appointments were open this morning. And again, we heard frustration from people who said the website was crashing and the time slots were disappearing immediately. One viewer told me they set up 3 computers just to try and beat the rush. And health officials say that they're trying to improve the user experience, but unless the state's strategy or technology changes in any drastic way, the first come, first served scramble is likely to continue for the foreseeable future or until, supply really ramps up.
Yeah, I was really shocked when we learned yesterday that 2.5 million people visited that vaccination website on Friday at 5. And for people who want to learn more about where the state stands right now with vaccination trends and eligibility, we of course have much more, including Eli's interactive charts right now on WPRI.com. Eli, thanks.
Good to be here.